Kampo. Welcome to another episode of our podcast series Preparing Bhutan, where we dive deeper into topics around HIV prevention, PrEP, and health advocacy within Bhutan and beyond. I am your host, Regita Gurung, and today we are honored to have with us a very special guest, Dechen Dolkar. Dechen is a National PrEP Coordinator under the Sustainability of HIV Services for Key Population in Asia Program, Phase 2. This initiative is implemented in partnership with Save the Children and operates under the guidance of the National HIV and AIDS Control Program. In her critical role, Dechen oversees the implementation of PrEP services across the country, ensuring that they align with the national guidelines and protocols. She also leads the training programs, community engagement efforts, and awareness initiatives while collaborating with various stakeholders to address challenges in service delivery. Her work is very imperative in expanding access to PrEP for key populations and strengthening the HIV prevention across nationwide. We are very honored to have you and welcome to the podcast, Dechen.
Thank you so much for having me, Regita.
And how are you feeling today?
Excited.
It's an honor for us to have the very National PrEP Coordinator, and we have in our previous episodes talked about PrEP, but because you're working on it daily, we'd like to know from you, what is your role actually as the National PrEP Coordinator, what it looks like, and how your day-to-day life also looks like working in this particular field?
Okay, thank you for the question, and yeah, you have introduced me and you have also outlined what I do. So if you see what happens in a day of a PrEP coordinator, so you'll be seeing me running around trying to coordinate meetings, then planning about the PrEP services in Bhutan and like the trainings and etc. and etc. So basically I look at the coordination of the work, so I make sure that PrEP services in Bhutan is going smoothly. So I hope that answers your question.
That does, and I can tell that you're a very busy woman.
Oh.
Now, so this introduction of PrEP in Bhutan has been relatively new, right? So how has the journey been like? And also, what are some of the key milestones that you and the team have achieved so far regarding PrEP?
So yeah, I'm pretty sure the people who have been interviewed must have told you about the PrEP, but yeah, we have introduced PrEP this year. And we have developed the SOP and guideline for PrEP. So, and as a matter of fact, now we are in the phase 1 implementation, and we have started this PrEP initiation at HISC, Thimphu, and CHT JDWNRH, and at Paro Hospital. So anyone who wants to avail PrEP, they can go there and enroll themselves for PrEP. So the journey has been very interesting and challenging as well.
But in a very short duration, those are amazing, I think, achievements. So congratulations.
Thank you so much.
And I also can see the visibility and the success of the very program. But I'm sure it has not been easy, right? It's been not even a year, but and it's a very important but also a very sensitive topic.
Yes,
I think if you could kindly tell the audience some of the challenges that you and the team have encountered when trying to expand the access of PrEP for the key population primarily, and how have you addressed them, or how are you addressing them at the moment, the challenges?
So yeah, some of the challenges that we have faced is that we have, technically we have developed all the SOPs, guidelines, and we have trained all the health workers and on the SOP and guidelines and how to approach the community and all, but in reality the uptake of the PrEP is very low. So the whole point of our project is questionable if there's no uptake. So these are some of the challenges. So we it's just been a month, but we have so far we have 26 people enrolled in PrEP. So I think this is some of the challenges because of the uptake. So I think the reasons maybe because people are, especially in the community, people are not very aware of PrEP, and even if they're aware, they're not very willing to come out because they have to do testing, and they are not ready to do testing and go to the health service providers, especially the hospitals. So they're only comfortable to open up to certain group, certain health workers and etc. like that. So because of that, we are having a lot of challenges to convince them to uptake PrEP get themselves tested. So to overcome these challenges, what we have done is that we have also hired a community consultant who is from the community, because we believe that if inclusivity is the key. So having learned, learning from him about the community, so it makes us sensitive enough to understand their needs. So we want to make sure that whatever the challenges is, we address it. So we also have, so far we also have had focus group discussions. We have invited the communities, we have listened to their concerns, and also so far things are going well. We have had challenges. We are trying to meet a lot of people through the community, such as Pride Bhutan as well, and Core Voices of Bhutan. I'm pretty sure you must be knowing about it. So yeah, these are the certain things that we have been doing to make sure that advocacy is done right, and we overcome these challenges. Yeah.
So it seems to me that the PrEP coordination team is doing their best.
Yes.
But this is a bigger bigger project that requires more support.
Yes.
So in that particular, I think, area, how can individuals, like anyone watching even this particular listening to this podcast, and other communities support the very national effort to increase, the awareness as well as the uptake of people availing PrEP?
Okay. So I keep on telling everyone, especially the community people who I know. So if you know about PrEP, please make sure that you encourage others to take PrEP. Give the right information. That's the key. So self-stigmatization is always there when we talk about PrEP and HIV/AIDS and etc. So I think what an individual and community can do is first do the self-assessment. You as an individual know whether you're at high risk to get HIV or not. If you think you're at the high risk, you can avail services at HISC, which is located in the center of the town. And you can talk with the health provider. So that's the easy way to do, and it's a very discreet thing. And we make sure that there's confidentiality. And I think what a community can do is encourage each other about it. Yeah.
Yes, I think it is very reassuring to know that these are very practical and easily accessible service,
Yes.
And hopefully while watching, listening to us, especially the community members are able to take on those practical steps that you have currently addressed. And I think that it's important that the rest of us also do our part in promoting this very important, I think, project. And you also mentioned about the right information, sharing or exchanging right information, which oftentimes becomes the biggest challenge, because for any sensitive or social topic that oftentimes is also taboo, there's a lot of misconceptions, right, and prejudice. So what are the common misconceptions about PrEP, and how can public better understand, and how do you tackle such misconceptions?
So there are several misconceptions regarding PrEP. So people think that PrEP is only for the community, the LGBT community, but I would like to address that it's not. It's for everyone. So everyone who is at the higher risk of getting HIV, you know your sexual behavior, you know about yourself, so you can access yourself and then avail the services. So this is one of the myths, because people usually align PrEP with the community. So I would like to say that it's for everyone. And then it's been a concern and also a myth saying that if somebody takes PrEP, you're not going to get STIs. So you're going to get it. There are chances of you getting STIs, but it's definitely going to protect you from HIV and AIDS. Yeah.
Oh wow, yeah, those are new information to me. So yeah, for those, I think, watching, listening to us, PrEP is for HIV prevention, not for other STIs. And like you mentioned, PrEP is not just for the LGBTQ plus community. It is for anyone and everyone. And like you mentioned, you have to self-assess yourself and your sexual behavior. So you know yourself best. You know what you're doing. So based on your habits, based on your, I think, practices, it's important that you check it with yourself and then see if you should get it. But I do suggest that most people should, you know, research more about it and get in touch.
Also, I would like to, sorry to interrupt you. So I would like to say that if you want more information, we do have the SOP and guidelines uploaded on the MOH websites, and we also have information in the Pride Bhutan's website. So if you check it there, everything is available there. And also there's a app called Access to Care, so you can also read it on the I mean, it's now everybody has a phone. Internet
Yeah.
is available, so please check it through, and then you can get more information on that.
Yeah, actually, that was my last question, regarding access to information, because of these stigmas around HIV and even PrEP, a lot of people might be hesitant to even try to find information about it. So you did mention right now that there are these information available online, so you don't even have to go to the hospital right now. It's literally, you can search it on your Google, on those websites and those apps. But any extra message, especially for Bhutanese community, right? Like, how do you encourage those, or how do you encourage others to, access those information when they can, and to encourage them to try and not be hesitant about reaching out for help and support?
About that, I always tell my friends and from the community and everyone saying that you should take charge of your health. You shouldn't self-stigmatize yourself. We understand about the confidentiality and the self-stigmatization, but if you think you're at risk, it's better you go get yourself checked, so that if you are safe, you can keep others safe as well. So that's my key message for everyone.
And that's a beautiful message, right? And I mean, it's 2024, we're about to start 2025. It's high time that we do away with these stigmas, this prejudice around HIV, around even receiving help that is available to us. And we are very fortunate that the PrEP coordination team, as well as the government and Save the Children and Queer Voice of Bhutan, by Bhutan, they're working together to come up with such important but also accessible programs time and again. So I really do hope that through these podcast series, you're able to understand that help is there, support is there for you, for us, and it's just, we just need to just reach out. So yeah, thank you so much, Dechen Dolkar, for giving us your time and for sharing such imperative, important messages to our audience. And yeah, we look forward to more of the work that you do. So good luck with it, and yeah, I'm sure it's going to be a success.
Thank you so much, Regita, and thank you, Queer Voices of Bhutan, for inviting me for this podcast. Thank you so much.
Yes. With this, we wrap up today's episode. A very heartfelt thank you to Dechen Dolkar for joining us and providing us with such valuable insights into her role as the National PrEP Coordinator and the incredible work that she and the team has been doing for the SKPA Program. As Bhutan takes significant steps towards introducing PrEP, it's conversations like these that help dispel myths, foster understanding, and encourage proactive HIV prevention efforts. So let's continue to support and empower our communities by staying informed and breaking down barriers. Thank you for tuning in, and don't forget to follow us for more episodes in this series. Until next time, stay safe, stay informed, and take care.